Hello everyone, I am Dr. Prapanna, a practicing hair restoration surgeon at Graft Cosmetics and Hair Implantation in Koramangala, Bangalore. Following are the steps that are followed in follicular unit transplantation. First, preparation of the donor area. Local anesthesia is used for the entire procedure. The hair in the donor area, that is occipital region, is trimmed to a length of about 2 to 4 millimeters, and local anesthetic solution is injected just below the donor area. Next is harvesting. The donor strip is usually harvested with a single bladed knife. The hair in the lower part of the occipital area and the temporal areas are finer, and these should be used to create a new hairline. After the strip has been harvested, the gap can be closed either with staples or sutures. The next step is graft preparation. The harvested donor strips are immediately immersed in chilled normal saline. Proper hydration of the donor grafts with cold saline is very important throughout the surgery, as it influences the survival rate of the grafts. If a single large strip has to be harvested, it can be divided into smaller pieces or slivers before cutting the individual grafts. Graft preparation with a dissecting stereomicroscope makes the dissection a little slower, but it is much more accurate. The next step is preparation of the recipient site. Anesthesia for the recipient area includes a supratrochlear and supraorbital nerve block, followed by a ring block in the frontal area beyond the zone of hair transplantation. While making the slits or using implanters in the recipient area, it is very important to follow the direction of the existing hair in that region. The hairline should have a rugged or sawtooth appearance to give a natural look. About 250 to 300 micrografts are necessary to create a normal hairline. Now, graft insertion. The grafts are placed into the recipient slits using fine angled forceps. If an implanter is used, it would generally not require a forceps. It is important to employ atraumatic technique in graft placement. A steady pressure is applied to ensure that the grafts are flush with the surrounding skin. Grafting sessions can last up to 5 to 6 hours, in which 2000 to 3000 follicular units may be transplanted.